Hello, Focus Academy world. Dr. Amy Spoelstra here, and I am here with I'm going to say it, with a legend in the pediatric and neurodevelopmental world. I have known of this beautiful, wonderful doctor, Dr. Sonia McGowin, for years. I don't even know how many years. We've shared patients. We don't live anywhere near each other, but she's so well known and does such great work in this world with helping kids and families who are impacted with behavioral learning, socialization challenges, PANS, and other health challenges, chronic and acute. That I started to hear her name years ago, and I started to hear my practice members who are working with her in different ways, and I went, who is this lady? I need to know this lady. And here we are. Dr. Sonia has joined the Focus Academy as one of our certified doctors. And I'm just blown away. When I saw her join our certification series, I was so honored because she brings so much to the table with experience, personal and professional, and her reputation is so exceptional in the way that she helps people. I'm honored to have you here. I want people to know just how incredible of a provider and a person you are. And I just want to ask you, Dr. Sonia, why, after everything you already do and what you bring to the table and the experience you have, why did you pursue being a part of learning in the Focus Academy and bringing this to your patients and bringing the neuro-deflective piece of the puzzle to your patients? Why were you motivated to do that?
That is such a good question. I'm kind of a perpetual student. Like, I get bored really easily. I always need to be learning something new. And I have the privilege of working with so many people who live everywhere in US and the world. And I always hear what they say. And I've done the biomed approach for years. And I mean, I won't lie, I'm pretty good at it.
Yes, you are.
But for some kids, there's a missing piece. And I'm always like, what is it? What am I missing from what I'm doing? And I remember, I think it was last year, you even Facebook messaged me and said, hey, I've got room in you should come to Idaho. I've got room in this class. And I just, it's all about timing. And there was something that came across my awareness, and I was like, this is it. So I watched the modules and I was like, this is it. This is what I have missed in designing my practice. And so once I was in, I was all in. Both feet, Idaho, last month, like
That's right there. Yeah. Cute little Airbnb in downtown Coeur d'Alene.
Yeah. And my husband and I are already saying, hey, maybe
Hey,
we
we've got space for you. If Dr. Sonia wants to come and practice in Coeur d'Alene, we will make space for you in this practice. You hit that right on the head. That's the thing. First of all, this is probably why we immediately clicked as, personally and professionally and intellectually is that piece of, I think that's what makes a good provider. I want to always be learning. I don't ever feel like I know, this is what I heard you say, that I know all the things. Like, there's always more to learn. It doesn't mean you depart from what you already are doing and the excellence of that, but knowing that there's more to the story for some people, and that it's not a one size fits all, but there's different clinical reasons to bring in different clinical tools, mentoring tools, educational tools, parenting tools, emotional tools, all of these different things, they all have a place. And so that's the beauty of that's the exciting part about having you as a part of this Focus Academy and bringing this to your patients, but also selfishly, I will say, for our Focus Academy community, for the doctors and other providers that are in the Focus Academy, it's a real benefit to have you with us, because you can bring your experience and your clinical tools from the biomedical world to help more people. And so this is just a really, really cool thing. One of the things that I've found that is a common thread through providers that I have found make the biggest impact with their patients is that it's not just a job. It's not just this is what I chose to do as a profession, but there's some personal reasons why you even got into this. And that's one of the things that I think is really wonderful, challenging and wonderful, but that probably drives you about you. And so can you elaborate on that a little bit for our listeners?
Sure, of course. So I have 2 kids. They're bigger now. My daughter Libby is soon to be 18. My son Rowan is 16. Libby had a very adverse reaction to the things they do to babies when they're little.
Mm-hmm.
Very, very serious and adverse reaction. And even though we were doing a modified schedule, the DTAP just blew her to pieces.
Mm-hmm.
And she recovered, praise God, because I had an idea of what was happening. So when Rowan came, he had none of those shots, but he did have the vitamin K. I was so worried about vaccines that I didn't really think about the vitamin K.
Yep.
And as he, was born with eczema, red flag, as he went through development, we were seeing that things weren't okay. Lots of food allergies, lots of skin issues, lots of behavior problems, self-injury. He was nonverbal till he was 4, very serious behaviors. And so he was really this close to an autism diagnosis. And I wasn't a doctor then. I literally went everywhere. I went everywhere to try to find help for this boy. And everybody just patted me on my head and said, oh, he's the younger of the 2. He's got, a verbal sister. He's a boy. Wait and see, blah, 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 nonsense, right? And so kind of in the midst of this, when he was about not yet 2, I went to chiropractic college. We moved across the state, started school, because I had worked with people with autism my whole career. And I had an epiphany that this is not genetic. Like, there's more to this. I need to be, a qualified person to work with these kids. And so I worked with a naturopath and, connected with different people, figured out what was going on with Rowan. And once we got the right approach in place for him, the right interventions, suddenly eczema's gone. He's sleeping all night. He is no longer self-injurious. And he started talking. And so he was nonverbal at 4. And by the time he went to kindergarten, he was indistinguishable from his peers. Yeah. And so I really do call him my first recovery story. Now he is, he's perfectly fine. He has dyslexia. He has auditory processing disorder, but we'll take it, right, over something else. He needs no support in school. He's A's and B's. He's a theater kid. He's getting ready to get his driver's license. Really fantastic. And so what drives me is that story, and really that feeling that I had when he, from the time he was an infant until he was in kindergarten, of why is there no one who knows what they're talking about? Why do I sit here in the middle of the night holding this screaming baby and there's no one to help me? And I feel alone and lonely. It's 16 years ago and I still get verklempt about it. So what drives me now is I have designed a practice that I needed when Rowan was little. And so I don't want moms to feel like I felt. And I don't want them driving all over the state just to have someone pat them on the head and tell them to wait. Waiting is the last thing we need to do, right?
Yes.
And so we were the lucky ones. Libby's okay despite her adverse vaccine reaction. Rowan is okay despite the vitamin K. Why that happened, why we were spared, I don't know. But I tell you, I don't take it for granted. And I remember it every single patient who walks through the store. So, yeah.
Thank you for sharing that. As I said before, there's this common thread that I see in really driven providers that are really in this to make a big impact and that want to always learn and are seeking to always learn and bring things to their patients, to the people they work with, to be there for the moms. Like my family was impacted. Lots of families were impacted in lots of different ways. And when we see families, kids, adults that are not engaging and connecting and learning in their environments and with their world and with their peers in an efficient way, that can look all different. It can look really severe sometimes. It can look like anxiety sometimes. It can look like learning challenges sometimes, but it's impacting that life and that family. And there's no one size fits all, but there is kind of a clinical roadmap based on what we know, based on biology, neurobiology, based on how the brain develops and works and processes and how we detox and how we process our environments and our epigenetics and our genetic variants and all of these things. And we have to bring that together. And you just do that so wonderfully. And a lot of our providers do, but I just want to thank you for sharing your story, for being, intellectually curious and being motivated to continually do better and bring more for these moms out there that are looking for answers. And unfortunately, there's more now than ever before, I think. And I'm just so thankful that we have you as a provider that can help your local community. And also, if somebody's listening to this and they're like, hey, I don't live near Dr. Sonia or Dr. Spoelstra or somebody who is certified in some of these approaches in the Focus Academy, please don't hesitate to reach out because we can connect you, or you might even be able to. I know you can help people that don't just live in your area. So I would love to just conclude here by having you just share how people can get a hold of you, how they can reach your office and connect.
Of course. So our website is covenantwellness.net. They can email me, Dr. Sonia at covenantwellness.net, and we would be happy to help in any way. We're also on Facebook. We have a Facebook page, and we're on Instagram. So all the platforms,
all the things.
Yeah, happy to help anyone who's searching.
Great. Well, wonderful. Thank you so much, Dr. Sonia. And we look forward to having you probably come on here and we'll do some fun things and talk about some other just topics after we've done this introduction. So be following the Covenant, you said Covenant Wellness Center. Yep. And the Focus Academy if you want to get more from this wonderful provider here. Thanks, everybody. And remember, there are no bad kids and all behaviors are there for a reason. So we don't want to cover behaviors. We want to understand them and we want to help families have a better expression of life.